Breast reduction surgery is when small amounts of tissue are removed to make the breasts a smaller shape in line with how you want them to look, essentially, and how you visualize them. If you're looking to remove some breast tissue and to get a smaller appearance of the breast, then breast reduction may be for you. So when you go for your consultation for breast reduction, you'll have a chance to speak to your surgeon about what you want to achieve and what they think is achievable. Together you'll formulate a plan, working together to work out what's best for you, because it's your care at the end of the day and you're very central to it, and that's the most important thing for us. Your surgeon will also be able to talk you through any risks and how we counteract them and how we hope to make this the safest procedure for you possible. You'll also be able to discuss scar placement and the likelihood of scarring, risks associated with scarring, and how to look after scarring, including aftercare as well. On the day of your breast reduction surgery, you'll come through and you'll meet our lovely front of house team, who will ask you to take a seat in our waiting room. Once they're ready for you downstairs, our admissions and recovery nurses will come up and greet you. It will be a nice chance for you to meet them. These are the people that will be looking after you throughout your stay. They'll take you downstairs, they'll do all of their checks, get you sorted in your gown, in your socks, and get you ready to go, essentially. Once you're deemed safe by them, you'll then be seen by your surgeon. Your surgeon will go through exactly what you want to achieve again, just make sure that everyone's on the same page and that you're happy and comfortable with the procedure. They'll also go through your consent forms with you again, give you a chance to ask any questions and make sure that you fully know all the risks involved of the procedure that you're going to have. Once happy and once all signed off, you'll then be seen by your consultant anaesthetist, who will go through the anaesthetic process with you. They'll talk you through the medication, how it will make you feel, and the recovery as well. And also they'll ask you some of the same questions that you've been asked previously. Again, it's all just to keep you safe, so do not worry, it's nothing to be concerned about. Once we're ready for you, you'll be taken through to our state-of-the-art theatre, where you'll be looked after by your theatre team. So that involves your surgeon, anaesthetist, your ODP or anaesthetic nurse, and your circulating practitioner. So you've got plenty of people around you to keep you safe, or looking out for you, essentially. The procedure itself takes about 2.5 hours, sort of on average, and that kind of involves the removal of the tissue that you want and the desired effect that you want, with the scars as discussed. After the procedure, you'll wake up in our recovery room. So you'll be surrounded by nurses. It's a very clinical environment. It's a very safe environment. You shouldn't wake up in too much pain. We do our best to manage your pain throughout the surgery with various different medications. But if you do have any pain, you've got plenty of nurses there to support you and to provide you pain relief should you need it. Once you've completed their recovery checklist, essentially, you've been to the toilet, you've had something to drink, something to eat, and you're deemed fit to go home, they'll give your chaperone a call and your chaperone will come and collect you. The following day, you'll receive a phone call from one of our post-operative nurses. They want to make sure that you're safe and that you're recovering properly, so they'll ask you a few questions. On this phone call, we'll also book for you a follow-up appointment. Usually this is about 5 to 7 days after the procedure, depending on the surgeon's instruction specifically for you. At this appointment, we'll usually take down the dressings, have a little look at you, check that you're wearing the garment appropriately, and all those things like that. Now, you'll also get a phone call from a nurse on day 3 and day 5, just to make sure, again, that you're recovering properly and you feel good and you're happy with your service as well. If you have any concerns along the way, always give us a phone call. We're there to look after you. We want to make sure that this is the best journey for you and the smoothest journey for you. Surgery is something that's scary for some people, but it doesn't need to be. And with the right support, we can make it as an enjoyable journey as much as possible to give you the result that you want. Centre for Surgery prides itself on being patient-centred, and what I mean by this is we're not a company that is pushing patients through the door. It's not sales-focused, it's results-focused for you, based on our patients, for our patients. This is something that sets us apart from many of our other competitors on the market, and it's something that you'll notice as soon as you walk through the door of Centre for Surgery, essentially. It's a warm environment, it's a happy environment, but it's a medical environment and it's a clinical environment, and it's there to keep you safe. From my experience, I've seen so many happy patients in and out of these doors with results that they've wanted for years, for many years, and they've been achieved, and it's changed their lives profoundly. So all I can say is we really can't wait to have you here. We're looking forward to seeing you, and we're looking forward to your journey as well, and to helping you achieve what you want to achieve.